Type 1 diabetes is caused by an autoimmune reaction that happens in your body. So a lot of times there's like a trigger. So there's a stress or an illness and your body tries to fight it. And then all of a sudden your body gets confused and your body fights its own pancreas.
So pancreas just said, screw you, I'm out. And now I get to do what the pancreas does.
I think one thing that's very exciting is we do have a pretty good crystal ball now to predict who is at risk and who might go on to develop diabetes and ways to prevent or delay that from happening. One factor that really helps us is the discovery of autoantibodies.
The antibodies are essentially proteins. They're markers of inflammation, autoimmune inflammation happening in pancreas.
And it turns out we can measure 5 different types of antibodies now.
And those antibodies just show the level at which your immune system is attacking those insulin-producing beta cells.
And these can appear months to years before the development of clinical disease.
So we typically think about type 1 as a childhood disease, but most people with type 1 diabetes are adult individuals. Historically, a lot of adult people were probably misdiagnosed with type 2. So nowadays, antibody screening becomes a standard of care.
I was originally misdiagnosed with type 2 diabetes and then re-diagnosed later in life with type 1 diabetes. I told the doctor all of my symptoms and they said, okay, well, we're gonna run all of the normal labs for you and we're also going to test your A1C, which is your 3-month average of your blood glucose. And he was like, your blood sugars are extremely high. And so the doctor told me, you have type 2 diabetes, like change your diet, exercise, come back and see me in 3 months. I was misdiagnosed for 4 years before I was given the proper diagnosis. I finally went to go see the endocrinologist and I told him my entire story in tears and I was like, I don't know what else to do. And he looked at me and he said, you sound like a classic case of LADA. And so he asked me, well, have you ever been tested for antibodies for type 1 diabetes? And I came back positive for the GAD antibody and the IA2 antibody. My doctor also tested my C-peptide levels and he saw that my insulin production was extremely low. So he said, we're going to classify this as LADA, but this means that eventually you will progress to type 1 diabetes.
So the test for antibodies implies a blood draw.
And so doctor came in and just kind of explained how we're like higher risk because our sister has type 1 diabetes. And then she said, go downstairs for some blood work and got some blood drawn. It was my first time getting blood drawn. I was pretty nervous. Turns out it's no big deal. And so, yeah, and then we just waited about a week or so. The doctor called with our results, and across the board, we were all negative on screening for type 1 diabetes.
So typically, if your results are negative, this is reassuring. And unless you have a very strong suspicion, you probably don't need to repeat them again.
You already get your blood drawn for all of your other labs. And so they just have to order the extra blood test. There's nothing special about it.
You can talk to your primary care doctor or your endocrinologist and see if they could potentially order antibody testing.
You can buy a kit online just off the internet, but sometimes those kits don't have all 5 antibodies.
There's a home kit where you could just poke your finger and get a capillary sample out and then send that back directly.
You can enroll in something called TrialNet, which is for relatives of people with type 1 diabetes. It's completely free.
So this effort for screening for risk for type 1 diabetes, it only started as part of a National Institutes of Health, NIH funded project. It was originally Diabetes Prevention Trial Type 1. It helped give birth to a very robust program that's been going for over 2 decades now called TrialNet. So we not only screen, but we think about what are interventions that we think could help either prevent progression to type 1 or to extend the honeymoon.
We don't have to wait until it's a crisis in order to diagnose type 1 diabetes. Now, like with my case, I knew that I was diabetic before I even needed to take insulin for meals. And so if I can give that to my daughter, yeah, absolutely, I would do that.
I didn't want to necessarily subject my potential children to what I had been through in the healthcare system. But knowing now that there have been like so many resources developed and that there is screening for those early stages so that parents can understand their children's risk and stay ahead of it, I think it makes it just an easier decision.
The idea of screening early has like completely shifted my perspective on having kids, where I always know that I wanted to have a family. I'd love to not have kids with diabetes, but if that's the case, screening them before would really help, like take away a lot of the anxiety I think about having kids and planning a family.